Welcome back to News at Noon on ABC 36 News Now.
Hey friends, welcome back in. Well, if you are looking for other options besides traditional medicine, we may have just the solution for you. Dr. Mullins, who was awarded the Doctor of the Year in 2023 and 24, is at the head of what has been called the future of healthcare, Marshall Lifestyle Medicine.
And here to talk more about one aspect of it, which focuses on medicine for longevity, is Dr. John Mullins. Thank you so much for stopping in today. We appreciate it.
I appreciate it as well.
So we're talking about a new way of thinking about healthcare. We're talking about longevity, but also concierge too, medicine. Let's talk about the both of those areas, concierge and longevity.
We'll start with concierge medicine. Concierge medicine has just been born out of some of the frustrations inherent in the healthcare system for long waits to get in to see your doctor, limited amount of time to actually see your doctor when you're in the practice, and the frustrations that happen on nights, weekends, and holidays when people tend to get sick or need help from a physician with no accessibility. So concierge medicine kind of solves those issues.
Wow.
People pay a surcharge to be able to have improved access to their doctor when it's convenient for them, not necessarily convenient for the doctor.
I see.
So that has been a movement that started probably in the last 10 years, and it's picked up a lot of steam.
Right.
Primarily just because healthcare in its current form is very frustrating.
Yes.
Well, and for decades, we've been in this routine of waiting 30 minutes, 45 minutes, plus.
In some cases,
Yes.
an hour. Right now, I think it's 21 days to get in to see a doctor for an appointment. By then, you're either over whatever you initially had, or you've long since passed away.
Right.
But it's just not set up for convenience.
So when you hear that name concierge, you think custom, you think tailored to your schedule.
You should think of something that's customer related.
Very good.
It's designed around the needs of the patient, and that
Okay.
is what we try to do.
I love that.
So what do you offer at Marshall Lifestyle Medicine then? What is it that you offer?
Well, our focus is, we like to talk about this all the time, is the future of healthcare must be different. We have no other choice. In a recent study in 2024 of the 10 wealthiest countries' healthcare systems, the U.S. ranks dead last,
Oh, geez.
despite paying and spending 2 times more than any country in the world. And that's expected to get worse over the next 20 years. We're supposed to rank somewhere in the 70 to 80 of all countries in the world, despite being the richest country in the world. So at Marshall, what we focus on is results. We are interested in getting people healthy and avoiding chronic disease that leads to death, disability, suffering, and we focus on root cause as opposed to just reacting to when people get ill. We try to prevent it from happening to begin with, or to try to get people to an ideal state of health so they don't develop it subsequently.
Right.
And that is all we focus on.
My goodness. So those statistics, and of course Kentucky, continuously, notoriously rating so low with healthcare. Were those some of the drivers that led you to open Marshall?
Well, I've had several drivers, one of which was the fact that my mother and father both died in their late 60s from chronic disease.
Too young.
I grew up in rural Kentucky. Lifestyle played a critical role in the development of those diseases, which is why I chose the word lifestyle to begin with. And it's fascinating, and even as a doctor, I did not realize through the course of my training that most of what affects us is completely preventable.
Yes.
It's just decision making, and it's cultural, and it's just having to re-educate the public and the doctors, because the doctors were not taught to talk about this. We were taught to see people when they're ill and then react to it. It's called reactionary medicine, which is why in their current model, things will not get better for a while, because the training for physicians is not geared towards preventing illness. It is 100% geared towards recognizing disease and then offering a treatment plan. And in the United States, that treatment plan is very, very, very expensive.
Right.
Wow.
Right.
You know, we talk about big pharma and all you want, but there's a lot of money that goes into spending for pharmaceuticals meant to manage our chronic disease.
Wow. And what would you recommend to people out there that are hearing this right now? What would be your recommendation?
Well, for one, I think it's time for people to have to be their own advocate.
Yes.
Just, your future health is not predicated on what happened to your family. A lot of times we talk about the genetics. It plays such a small role in what ultimately happens to us. It's almost entirely related to the decision making that we're making now and the decisions we'll make in the future. I would suggest for anybody that's interested in this approach to medicine, and I think this resonates with a certain subset of folks, to schedule a time with either someone like me, and there's a revolution happening in healthcare where there's lots of doctors like me that are interested in a new approach to their healthcare. We spend almost an hour to an hour and a half with new patients. Wow. That's unheard of in most practices.
It really is.
And but you need that amount of time in order to develop a personal relationship and therefore a personalized plan of approach for them. You cannot do it in 5 minutes, 10 minutes, 15 minutes. It just doesn't work. So I would say start with being an advocate for your own health. Start doing research about things that you are interested in, and there is a whole new world of longevity that exists that most people are not aware of, and it is something that is life-changing, life-altering, and life-optimizing. Wow. And rather than just focusing on how long we live on this earth, I want to focus on how long we live on this earth healthy.
Right.
It's it isn't about how long we live in a nursing home. It's how long are we still able to participate in sports and go out and have dinner with your friends and family and play with your grandkids. And that's what I'm interested in.
This is going to resonate with a lot of our viewers. It's resonating with us here on the couch. What's the best way for folks to reach out to you and start that journey with your practice?
Well, they can obviously go to our website or our social media. It has our contact information on there. All of my patients have my personal cell phone number. So if you know somebody that knows me, it's probably not too hard to track me down. I do a lot of consultations over the phone. I treat people in over 40 states. It's something that I'm not hard to find, and if they're interested in doing it in a formal manner, just go to our website at marshallifestylemedicine.com, and there's a thing you can pop up and you just put your information. We don't charge for simple meet and greets. We have people come in, we shake hands, show them around, and it really takes some of the pressure off somebody that may be just a little foreign to this concept, and it's meant to be that way. It's meant to be welcoming.
That's great.
Access also unheard of.
It really
Doctor, thank you.
You're very welcome. Thanks for having me and let me
stopping by today.
share my vision for future.
Yes,
we appreciate
absolutely.
it.
Thank you so much.
Back after this, folks. Stay with us.